June 11th is globally recognized as a World Prostate Cancer Day. And that's a good time for us to focus on one of the most pressing health diagnoses that affects men worldwide. It's the second most common diagnosed cancer amongst men, affecting about 1.4 million cases, new cases every year, and 375,000 global deaths in 2020. In sub-Saharan Africa, however, it is the leading cause of cancer-related deaths amongst men, especially due to factors like late detection, limited awareness, etc., etc. And in Ghana, it remains one of the top causes of cancer. Despite all these dire statistics, public dialogue about prostate health remains rather limited. Today, this episode aims to change that by asking the question, what should every man really know about his prostate? This conversation is not just for men, it's for families, partners, and communities who want to protect the men in their lives. With us today to discuss the broad topic is Dr. Edward Kofi Boakye. He's a specialist urologist with the Greater Accra Regional Hospital, also known as the Ridge Hospital. Dr. Boakye, you're welcome. Also with us is Dr. Bright Kojo Kewu. Did I pronounce it correctly?
Yes, please.
Oh, thank you. He's a doctor in charge of Executive Prostate and Herbal Center, who is a medical herbalist. So today we are getting solutions from left and from right. Wherever a disease goes, we'll find it and we'll deal with it. Gentlemen, thank you very much for coming. Are there many female urologists? Because I'm a gynecologist and I look after women. So you should also have female urologists who only look after men. That'll be quite nice. Dr. Boakye, how bad is the prostate disease burden amongst men in Ghana?
It's really bad. Majority of patients who see the urologist are patients suffering from prostate.
So in your clinic, out of 10 patients who come and see you, how many are coming for prostate issues?
8.
Are you serious?
Yes, only 9.
Are you serious? And your average clinic sees how many patients on a clinic day?
Oh, around 20, 30.
About 30.
Yes, yes.
And 80% of them, sometimes 90,
Yes.
all have prostate issues.
Yes.
Hey, okay. And it kills a lot of them?
Yes.
Is it painful?
Don't go to us, practitioners. Don't go to nurses and people who have problems with the patient.
So the patients have pain.
Yes. And doctors will feel the pain. Because once they reach to them, unfortunately, they can't do this.
When I was a house officer, one of the things they warned us when we started was that you will get your first case of somebody who comes on a large prostate who can't urinate. And you see a grown man misbehaving and he can't control himself. And you don't believe it until you see one. And then you realize the fact that, hey, it's prostate business. It's not a joke. So the majority of the problems are benign or majority of the problems are cancerous.
It's difficult to say because the cancerous patients come this they're not the most diagnosed.
Okay.
Right? The benign cases they present quite often. But it's difficult to tell because you know the way Ghanaians see diseases. The disease must be present before they see the doctor.
Okay.
And that is why it is common to see patients with prostate cancer presenting. Okay, those who have lower unilateral symptoms, which could be due to benign hypertrophy of hyperplasia of the prostate, may choose to go to other places. Okay, for their treatment, unless maybe after walking and then taking
and treatment failure,
then they come to us. And when they come, we generally, it's just an axiom that any patient that comes with lower immune tract symptoms, please look for prostate cancer and you'll find it. So that's why we tend to see many of them in that situation.
So, what exactly is a prostate gland, and what role does it play in the body?
Well, the prostate gland, glands are organs within the body that produce, substances. Others will call them discharges. We call them, they secrete. Substances that in one way or the other, carry out specific functions. The prostate is a gland that is located. Others describe it as an almond-shaped organ that is located a little bit beneath the bladder, okay, and then behind in front of the rectum where the feces pass, okay. Then an area they call sphincter, which regulates the flow of urine. Okay, so that's where the prostate is.
So it lies
located.
just above the sphincter.
Just above the sphincter.
And just below the bladder.
Not below the bladder, but above the rectum.
Okay.
And then it is practically in conjunction with the bladder.
Okay.
Yes.
All right. Adjacent, but not directly. All right. And what does it do?
Through its discharge, it alkalinizes the semen. Yes. Therefore, giving the semen the nutritional medium to move and all that and that. But at the same time, it's also believed that it breaks down the semen into a liquid state which will allow the sperm to swim freely. These are the same the functions that have been adduced to the prostate. Though there's a huge suspicion that they could be involved in a series of functions that have not been discovered or authenticated. So the rest are all suspicions and other thoughts about it. But typically it's an alkalinizer. Okay.
Dr. Kew, how do you often see prostate cancer, people with prostate issues at your clinic?
Okay, thank you very much in the first place. Yes, we do see a lot of prostate-related issues at our clinic.
And how do they present?
Most of them present with the symptoms. They wait when they see the symptoms that we teach manifesting. Then they would want to come to the clinic to confirm. So most of them, when they start experience probably frequency of urination, what we call frequency of micturition, nocturia, maybe 5 times, 6 times at night. Though there may be other causes of the frequency of urination at night, but it becomes one of the reasons that they suspect to be the cause. So they come there to verify. So that is one. Sometimes too, some of them have strain of urination. So when they go to the washroom, they kind of have to use a lot of force to urinate. And that is also one of the symptoms that you are likely to experience when you are having difficulty with, or you're having prostate-related issues. Sometimes there may be division of the urine. What we call divided stream of micturition. Some of them may be caused by other infections, but it is also one of the signs that serves as a warning that your prostate could be, the integrity of your prostate could be damaged. So you have to take a look at it. There are those who have this lower abdominal pains, or some to have burning sensations when they are urinating. In extreme cases, others may experience blood in their urine, what we call hematuria. So they present with these signs and symptoms, plus others that probably I may not be able to mention, but these are a few that most people present with, and we see them almost on a daily basis. And like doctor said, most of them too would wait, and when the symptoms or the issue aggravates, that is when they want to come and see what is really happening. And for some of them, unfortunately, they end up realizing that it has developed, it's a cancer. And sometimes it becomes very difficult breaking that news to them, because like he said, you feel the pain as a man just to be told that you have developed a prostate cancer at late in life. It becomes a bit worrying, but somehow you would still have to break the news to them so that at least the appropriate measures can be taken to treat it. So prostate has become a common issue nowadays, and we see them every day. And considering the fact that our institution is a prostate, at a herbal center, in a way, it kind of draws them to come and have a look at their prostates.
What is the typical age of the patient that presents with a prostate issue?
Okay, so the typical age I think way back,
No, at
Five
your,
was-
at your
at our
facility.
facility.
Yes.
40 years and above, you have a lot of them present with prostate cases or prostate
Not
symptoms.
50, 60, 70.
No, even
40.
40. Yeah, 40. Right from 40, you see a lot of them, 40 and above. It used to be 60s.
Yes.
Things have changed. We've even seen people who were at the age of 35 and they had prostate related issues.
At 35.
Yes.
Seriously?
Yes.
Hey.
And it's quite
We
alarming.
have to start making changes to the recommendations we give about the ages at which people should start screening for
Oh
these
yeah,
things.
and I think doctor has also experienced quite a few of them. So it's not just the elderly now that are getting the problem. Even the young ones are also experiencing prostate cases.
I used to tease my colleague, who is a professor of urology, that I chose the wrong profession. I should have chosen urology instead of gynecology. And my reason is that by the time you have a urological problem, you have money. So you can pay. And if you don't have money, your children are now grown, so they can pay. So either way, there's more money there. From what you are telling me, at 40 years there, your children are not old enough to pay. So the burden is all upon you.
Yes. Yes.
It's too young, 40.
Yes, but you see, that is why the advocacy now is that make sure you check your prostate right from the age of 40 years. You can't wait till 50 or 60 before you go for screening. Because if you wait that long, you may end up detecting the problem at the late stage.
Yeah.
That is when it has advanced. So as early as possible, we keep advocating, we keep advising, just go and get your prostate checked. So that as soon as possible, once something is detected, then the interventions can be put in place. You see,
And the earlier, the better.
the earlier, the better.
Dr. Boachi, how does prostate cancer typically develop?
It's a huge, a big question. Okay? Because a cancer, like every cancer, cancer is a defeat of the immunological system
Yeah.
of the body. Okay? And that there are factors that permit rapid cell growth, and there are factors that inhibit rapid cell growth. In prostate cancer, a lot of factors are mentioned, cellular factors, okay, generally supported by hormone, in this case androgen, which lead to disorganized, progressive, and then a chaotic group of cells that do not go by the normal cellular system that govern cell growth. Okay, so it starts as something very little until it continues exponentially, occupying the major part of the cell, of the organ, until probably it spreads. It is very painful and very difficult in the sense that in all this growth, it's a silent growth. Okay, does not inform the body that there's anything of that nature going on until it gets to a point when it begins to compress, it begins to create problem for the body, and then it becomes symptomatic. Fortunately or unfortunately, prostate cancer, as I've seen in school, you are taught about the unique characteristics of prostate cancer in a patient, but throughout my practice, I've realized that prostate cancer doesn't
obey the rules.
It doesn't obey the rules. It doesn't even present alone. Okay, so at times you can have symptoms. We call them lower urinary symptoms. They are the very symptoms he has enumerated. We call them lower urinary symptoms, and they are present, but they may not be limited to prostate cancer. They may generally be, related to benign hyperplasia of the prostate. That's benign enlargement of the prostate, which is not cancerous, which has no capacity to spread. And then the patient present with their symptoms, and then all practitioners know that though they present the way they present, they could also have a cancer. And that is why even maybe the cancer could be diagnosed at a time earlier than when it has spread. But in the unlikely event that it doesn't present with or together with a benign enlargement, in the unlikely event that it presents as cancer alone, then it may not be symptomatic. And the day it becomes symptomatic, the day a single symptom presents, okay, as related to prostate enlargement or cancer, then it is too late. So this is how it behaves. But I must also add that the biological behavior of prostate cancer is not very, 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 very clear. These things I mentioned, they are all theories. Okay, some with practical foundations and others without practical foundations.
Excellent. It's one of the things that I was paying attention to, or I observed or noticed whilst we were talking, was about the fact that you have, by the time you see your first symptom, it may be too late when it comes to prostate cancer. If it's benign, no problem. But if it's cancerous, that is why the importance of screening.
Exactly so.
It's a very, very paramount step to take if you intend to avoid this condition.
And it comes with a lot of controversies.
Yes, yes, I do understand those. We have to figure out what works and what we can adopt and what
exactly so.
Ladies and gentlemen, we shall go for our first break, and our first song is "The Great Jehovah" by Joe Metal. Thank you.
Hey, everybody, let me see you dance. Oh, na 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 na, yeah. Hey, hey, hey. I have never seen a God like
Zed 101.9 FM.
no one else can.
No one else can.
Welcome back. This is the Zed Wellness Link. And today we are talking about prostate health on Z11.9 FM. My guest, a urologist, medical herbalist, and we are trying to tackle the prostates. We want to ensure that all of you have got good prostates and are doing well. Let me start with a question. Some lady was on TV talking about the fact that a man needs to have 21 ejaculations every month to have a healthy prostate. Dr. Urologist, is that true?
I can't vouch for that.
You can't vouch for that.
Yes.
Dr. Medical Herbalist,
But there's
is
a
that
but.
true? You wait, I'm coming. Is that true?
I don't think so.
You don't think
There
so?
are so many schools.
I'm beginning to get worried.
There are so many.
My
schools of
frequency
thought.
is too low for my health. And I need
Not
to
really.
make adjustments.
Not really.
Eh?
Not really. That's not really.
But if it is true, then we can set up a business. So. For prostate health, you come decompress, go 21 times a month. We'll give you a timetable. We'll give you reminders. We'll set alarm. Not really.
No,
What's the
not
bat?
There is a but because I'm thinking about the methodology of the study.
Okay.
Prostate cancer has.
You've seen the study.
I haven't seen the study.
Okay.
But I'm still imagining that some things might have gone wrong
Okay.
when the study was being carried out.
Okay.
Why? We say the biological behavior of prostate cancer is difficult to decipher. 2, it takes a long time to see how prostate cancer behaves in a patient.
Okay.
So, how was this carried out? Then, third, I come from a culture where sex is like, like it's something that is done. It's seen as very normal.
Yes.
Okay, people think that even necessary to have sex every blessed day. Yet they are not spared of prostate cancer and its worst forms.
Okay.
So I still, think about it. How did they carry out the study and how did they come about the concept that sex could be, a way to prevent prostate cancer? When you come to, the science of ejaculation, it is believed and it is being carried out by many people that inflammation of the prostate could be or lead to prostate cancer formation, and that people who do not get ejaculation as frequently as possible, prostatic fluid could accumulate, cause congestion, and then ultimately lead to inflammation. And that if inflammation was being suspected as a possible cause of prostate
Or a
cancer,
contributory factor.
then those who have not had the benefit of ejaculation for a long time might in one way or the other get prostate cancer. But again, even the concept of inflammation as being a predisposing factor, it is also flawed in a way in that there are no concrete studies to where we can definitely say that those who have had inflammations do have increased risk of getting prostate cancer, and those who haven't had it definitely will not develop prostate cancer. It is very, very difficult to do such retrospective study, asking people about their sexual life
10, 15 years ago.
Exactly so. This is why I have my doubts. But it may not be far-fetched for one to tell patients that, okay, if you want to have sex, have it as many times as you want. But for me to put a number that if you have had this number of ejaculations per month, then you wouldn't have prostate cancer, or your risk of having prostate cancer is greatly reduced by virtue of that. Besides that, the number one factor that actually predisposes to prostate cancer has nothing to do with the number of ejaculations one might have had in the past, and that is why I have my doubt.
And what is that number one factor?
It's the relationship you have with the patient who has had prostate cancer before. Family, genetics.
Okay, genetics.
Family and genetics. Very, 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 very key.
That has a strong association.
Exactly. Yes.
Good. Okay. So I guess we shall leave the 21 for now and be content in our reduced numbers. Dr. Kew.
Yes, sir.
how does lifestyle or diet influence our prostate health?
Okay, so we know that apart from the genetic predisposition, um, we know diet forms a part of everything we do. Basically, it has influence on not only prostate health but every other health-related issue, which we cannot take the prostate out. Now, one thing we need to understand is that there are studies being done
Mm-hmm.
which are now relating some dietary choices to prostate inflammation and development of prostate cancers, especially the highly processed foods. Some of them are now being linked to be the cause of prostate cancers and prostate enlargement. Well, they may partially be true, and there may be also some gaps in those researches. But we know that the body thrives on a lot of natural products. The body thrives on greens. The body thrives on antioxidants. The body thrives on nutrients that are beneficial to it. So once we deprive the body of those nutrients, yes, the body's response may be an inflammation. So our choice of food, alcohol, I know that alcohol is one of the predisposing factors. I think our urologists will bear with me that alcoholism, in a way, because of its chemical content, some of the alcohols in the system have got contents or chemicals in them that are toxic to the prostate. So in a way, they could trigger they could trigger cancers in the prostate. Some could even cause the bladder infections, and that could also cause some of the lower urinary tract infections that may sometimes be linked to the prostate, but some have also been known to affect the prostate in a way. We know that high fat diets, which may not only affect cardiovascular related issues, they could also in a way affect the prostate, because studies are now coming up and they are linking some of these things to prostate health development. So we cannot take diet out of the equation. Yes, diet could be a cause of prostate related diseases, especially the cancers. There were instances where at a point they were trying to advise us from desisting from the excessive use of microwaved foods, because there were researches that were confirming that the radiations that were getting into contact with the food when microwaved could trigger cancer cells in the body, not only in the prostate but in all other parts of the body. So yes, diets, our dietary lifestyles, yes, do play a role in prostate health. So it is advisable that usually when you are going for prostate health management, there should be some modification of your dietary lifestyle. At least there is a way you should go about your diet. Your choice of food would have to be modified in a way to also have an impact on your prostate health management. So diet truly plays a very important role when it comes to prostate. From my background, we believe in what we call active constituents or phytochemicals.
Okay.
And most of these phytochemicals, most of the beneficial ones, we get them from plants.
Yes.
And plants form the basis of our diets.
Yes.
Yes, so there are phytoconstituents that we have discovered that are beneficial to the prostate. So when you come to us, we those on the herbal medical side,
Yes.
we advise that you go on a lot of the greens,
Yes.
because we know the benefits that the phytoconstituent would give. We know what the sterols, the phytosterols, the tannins, the flavonoids, we know they are anti-tumor and they are anti-cancer effects.
Yes.
So we tend to advise that you go on them. When you go to places like China, they do a lot of green teas. And these are things that we are gradually advocating in our system as well. So we are trying as much as possible to reduce the intake of the highly processed foods. And that we are advising that people do more of the raw fish, more of the greens, more of the fibrous foods, because we know that apart from limiting the processed ones, we know that there are active ingredients in there that have beneficial effects to the prostate. So diet is a major factor.
So, can you give me an example of a Ghanaian dish that contains some things which are beneficial for prostate health?
A very typical Ghanaian dish that is very beneficial to prostate health. For me, a dish like brodian pesi with kontomire. You know, there is this local one that we usually, it is mashed in the
Apotoyiwa.
in the apotoyiwa. Yes, because of the antioxidants in the kontomire.
Those kontomire is boiled.
But you see, we try to reduce the duration with which you boil.
It's more blanching than boiling.
You know, some people boil the kontomire
until it's dead.
Before, but we advise that it's boiled moderately. You don't overboil it, and then you do the mashing, and then you just. Well, if you want, sometimes we avoid the use of the palm oil because we want to limit the saturated fats in there. These are meals that typically have a very good benefit for prostate health in men. So we put a lot of people on these natural diets, and we try to reduce the intake of rice, especially the white rice. You need to go on the brown rice, on the unpolished ones, because of the fiber in there. You like more fibrous content in there. And then we also advise that you do more of greens. When it comes to soups, do more of greens. When it comes to stews, do more of greens. So we have the airways have this ademe.
Yes.
Yeah, you need to do a lot of ademe. You need to do a lot of the bokobokos.
Which one is bokoboko?
There is this leaf we call bokoboko. It is there.
Okay.
Yeah, you need to do a lot of the okras too are there. They are equally good.
Okay.
These things we advise
will be beneficial.
Yeah, even when you are doing the okras and we advise you don't add the oils, because the ones you add the oils, they tend to form a complex in there, and it may inhibit the active compounds
that
from
you really want to
properly functioning. So these are some of the typical Ghanaian dishes. So in general, all our local dishes tend to be beneficial, not only for the prostate, but for all other aspects of our health.
Dr. Bachi, what kind of what lifestyle practices predispose one to prostate cancer? I think he mentioned alcohol.
Yes. I mean, for the benefits and then the purposes of conversation around prevention and then this, I mean, it makes a lot of sense and all that. Okay. But I also want to add that soups from tomatoes. Tomatoes has been discovered to have high volume of lycopene. And lycopene is an antioxidant. It is believed to prevent prostate cancer. It is believed to prevent prostate cancer. I mean, in all literature it appears there. But they are advocating that before you consume tomatoes, you must give it a little bit of heat. Okay, just a little heat, so that the active ingredients will definitely, present in the form that is, significant to the body.
Okay.
Now, asking about, lifestyle. I mean, we are told. I mean, I always want to put it that way. I don't want patients to stick to this part of preventive aspect of prostate cancer. I want them to think about the different things altogether. But exercise, okay, it is believed that people who have a sedentary life will definitely have problems with other diseases like cardiovascular diseases, and of course prostate cancer is not an exception. Obesity, okay, obesity has high concentration of fats, and then of course there's a hormonal imbalance. Okay, patients with hormonal imbalances definitely also have a increase or heightened risk to developing prostate cancer. So exercise, and the diet as he says. These are things that can be done to at least change the history, okay, of prostate cancer. I just also mentioned smoking, but it's not a very big deal, especially in Ghana. Smoking is not a big problem, and of course prostate cancer smoking is not a big deal. Unlike bladder cancer, where prostate cancer, bladder cancer, where smoking
is more directly related.
Yeah, exactly. But in prostate cancer, the direct effect has not been found. But as nicotine, affects almost every part of the body. It is also, I believe that we should desist from smoking.
Wow. So, patient comes and has a prostate issue. Typically, you would see him in the consulting room. You would have a discussion, and then you examine the patient. The examination is a digital rectal exam, where the doctor puts their finger into the man's bottom to feel the prostate. That is examination that people want to dodge. But what information do you derive from that examination?
Yes, urological orthodoxy demands that every man that comes to the urological clinic must,
Have a finger up his bottom.
Finger examination, yes. So it's not only in Ghana.
So if the guy comes with impotence, we'll still examine his prostate.
Well, if we want to look at it from a holistic point of view,
You still have to check.
exactly. If it's a patient that has that problem, though they don't have lower urinary symptoms, if you want to go by public health principles, such patients must also be examined to rule out prostate cancer because it's a deadly condition. Okay, but fortunately or unfortunately, I've stopped doing data rectal examination.
Why?
Data rectal examination can be very, very informative because you do, and then you look for the size of the prostate, whether it is enlarged or it is not enlarged.
Smooth edges,
The
rough
smoothness,
edges,
whether it is rough or
attached to mucosa, not attached to mucosa.
Elements that could suggest cancer,
Yes.
but not the enlargement, because urologists per se don't really need the enlargement of the prostate before they act.
Yes.
We deal with quality of life. We deal with what the prostate is doing to the body. So a patient presents to me with lower urinary symptoms that are severe enough to warrant the patient to present to us. Then we decide to do digital examination. It is not to see how big the prostate is, but it's to rule out, cancer in this situation. But in this modern world, there are so many things that you can have in hand, which the digital examination may not be very, important.
Okay.
Yes, because the digital examination is observer dependent. Okay, if you do it, your findings may not be that of mine. Okay, and then all other things that come with nuances when we examine patients. So I would say, well, if I examine and my findings may not strongly, suggest that you have a prostate cancer, then I may say I wouldn't waste time. But we have a patient whom we have managed, put him on a treatment, and then as time passes by, I want to see whether the prostate has reduced in size. Maybe I will do it. But for where, by virtue of the time.
So the alternatives are ultrasounds,
MRI, exactly. So and then the PSA.
and PSA.
Okay, yes.
Tell us about the PSA.
Yeah, the PSA is, as the name knows, is prostate-specific antigen. Prostate-specific antigen, as the name goes, is specifically produced by the prostate. Okay, it is a normal thing that the prostate produces. But in certain instances, the value of the PSA may go high. Okay, because either the prostate has been manipulated, because either the prostate has suffered injury, or because the prostate, has become enlarged. Okay, and then of course, ultimately, if there is cancer. So the cancer is by far the number one cause that pushes the PSA high. Okay, but there are some other conditions that will make the PSA high, and that is why, we generally say people should not, based on the PSA alone, to take, decisions.
A decision.
But in all this, a urologist is needed because it's only urologists who can actually understand and say, per this and per that, this increases in PSA is not worrying, or this increases in PSA, though it may not be as high, I will have to act based on one reason or the other.
So if you see a high PSA, it doesn't necessarily automatically mean that the client has got a
prostate cancer.
prostate cancer.
No. But
if it's a persistently high one,
Yes, I mean it is not 1+1. It is not like 1+1 is equal to 2. You may have someone. I had a patient, not even 1 or 2. I mean several patients who have had a PSA below 10. Okay, when you do biopsy, it presents as cancer. Then you have another patient who has a PSA above 10, and all the studies strongly suggest that they don't have cancer. So there are other things we do. If we have a percentage high PSA, there are other things we do, and then to say, no, this one I'm going to biopsy, this one I won't biopsy. Yes.
Ladies and gentlemen, it's time for our next break. This has been a very interesting and engaging discussion. All the men in the studio are listening with rapt attention. I think they are happy about the fact that they may not need to do a digital rectal examination. Our second song is the song called Blessed by Akesi Brimpong featuring Joe Metal.
Who am I that you are mindful of me? I am nobody, but you listen to me. From your mercies every morning I see. Oh, happy day, you have taken my sins away. Lord, you set your love on me, set your love on me, and you shine your light on me, shine your light on me. Lord, you set your love on me, set your love on me, yeah. And I can say that I am blessed. Adum Nami Ashram yo, Shram yo, Washem is Wakram yo, Adum Nami Ashram yo, Wakome Mwam yo, Amo Jesu bless me, bless me, bless me. Oluwa bless me, bless me, bless me. Jesu bless me, bless me, Jesu bless me. Oluwa bless me, bless me, bless me. Oh yeah. Lord, you have poured your anointing upon my head, and my cup is running over. Surely your goodness and your mercy, they will follow me all of the days of my life. Goodness and mercy, follow me. Kindness and favor, signs and wonders. Oh, na 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 na. I am blessed, I am blessed. Yeah. Oh, more Jesus, bless me, bless me, bless me. Oh, Lord, bless me, bless me, yeah. Oh, more Jesus, bless me, bless me, bless me. Oh, Lord, bless me, bless me, bless me. Everybody say I am blessed, I am blessed, I am blessed. Everybody say I am blessed, I am blessed. Everybody say I am blessed, 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 I am blessed. Oh na 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 na, I am blessed. I'm blessed in the city, in the field, blessed when I come in, when I go. Oh na 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 na, oh yeah. In the city, I am blessed. In the field, I am blessed. When I come in, I am blessed. When I go out, Adum Nami Ashram yo, Shram yo, Washem is Wakram yo, Adum Nami Ashram yo, Wakome Mwam yo.
You're tuned in to Zed 101.9 FM, your lifestyle, leisure, and business radio.
Welcome back. This is the Zed Wellness Link on Zed 101.9 FM. And today we are discussing prostate health with Dr. Boakye from the Greater Accra Regional Hospital. He's a urologist. And Dr. Kewu,
Yes.
who is a medical herbalist. And both of them specialize in managing the prostate and its issues. We've had quite an extensive discussion about the various aspects that for most people, what they come up with is prostate is enlarged, and that's why they come to hospital. And later on, we discover that for some people, they've got cancer. But for the majority of the people, the major problem is just that their prostates are enlarged, and therefore they have symptoms. Have we been able to educate people enough for them to know that, one, this problem exists, and two, there are solutions available?
I think the education hasn't really been that much, but to some extent, the very few that we are doing has been helpful, because gone are the days when we didn't have any issue to do with prostate. But these days, looks as if almost everybody is interested in knowing, and that is where, to me, it is a very good determinant or a very good indicator for us to keep on hammering on prostate health. So I think somewhere on the 11th, that's going to be World Prostate Health Day. So it's one of the means by which we keep on publicizing, we keep on teaching, we keep on educating people on prostate health. And currently, too, I think once in a while, a few institutions do come out to do screenings. And before they do that, they go on air and they educate people on prostate. On our end, for instance, because we focus more on the prostate, whenever we have the opportunity to speak to people on air, we educate them on the prostate, the need for them to screen, the need for them to know the state of their prostate. It's not on the high side, but to some extent, it is helping a lot of men. I don't know the number of people that go to doc, for instance, who claim that, well, they heard on the radio,
so they heard on
the television that prostate health is important. They need to know the state, so they are coming for voluntary checkup. I don't know. But on our end, we do get a lot of people like that. Probably because we do a lot of the advocacy on our own as an institution. Okay, so that is self-funded. But on the side of the government, I don't know of any known policy that is doing that advocacy. But on individual levels, there are quite a few people who are doing that. So the education is there. But I think that we can do more. We need to do a lot of those, so that we can get a lot of the men coming on board to do voluntary screening of their prostates, because they need to know to avoid the late detection of the disease. So there is the education, it is ongoing, but we can put in a lot to get a lot of the men involved in getting to know the state of their prostate.
Dr. Boache, do you have people coming in and just say, Doctor, I'm coming to check my prostate?
There are very few.
Very few.
Yes. All those who come to us, whether through the regular means or seeing us on private basis, they all come with one program or the other. Okay, so very few of them come that will have this or have that. It doesn't happen. Then we have another group of patients who are seen at let's say a workshop or educational meetings and the rest. Then they do a PSA for them. They say, oh, go and show it to a urologist. But it's practically inexistent for patients to walk in and say, I'm coming for prostate check.
Would you encourage people to do that?
Well, I will encourage people to do it, but not to see us as, because and that we can't deal with the patients with too many.
Yeah, okay.
But those who go to do scans and the PSA and come in, yes, the doors are open for them to come and see us. Okay?
So you would recommend anybody, these two gentlemen sitting here right now, you would recommend that they would do a prostate scan and a PSA?
Yes.
Starting from the age of?
It's also controversial. But starting from the age of 50.
We'll choose one and then we'll run with it.
I will tell them that from the age of 50.
You should do it.
Yes.
Every year? Every 2 years?
It could be every 2 years. It could be, every 3 years. Because the prostate cancer is a slow growing cancer. But what is the problem? Because we don't have the labs are also a problem. You do a lab somewhere that tells you have a PSA of this. Then the following day you go to do a different place and they give you a different value. Yeah. So, some patients do, do the checks from one place to the other. Until finally we say, okay, per days we are going to do that. Okay. But if everything were in this rightful place, a PSA pay, for people like us, the blacks, people are above 50 years, doing it once a year, I think it's a good idea. It's not.
This disease affects
Damage.
blacks more than whites.
That is what we know. That is what we know.
PSA, is it on the National Health Insurance?
I don't think so.
No, it's not.
Prostate cancer is not also on the national health insurance. It isn't.
It's not.
So men cry, why will our issues be important?
Because, excuse me the expression, men are stubborn. Men are stubborn. They have the problem, but they walk around with their shoulders, raised, thinking that they are men, and for that matter, nothing can happen to them. Okay, and that's the reason why men present in early stages of, of the disease. Men are stubborn. They will never go. You see, some are even dragged by their children or their wives.
Yeah.
How treatable is prostate cancer if it's detected early?
Potentially treatable or potentially curable.
Potentially curable.
Curable, yes. I mean, this is a short process. When we diagnose a prostate cancer, the first thing we do is to stage. Where is the cancer? Is it still confined to the prostate or it is moved beyond the prostate? So we stage it. If we find that the cancer is within the prostate, then we also analyze another parameter. Is this cancer bad? Well, it's not every prostate cancer that is bad.
Okay.
Or that is bad enough to
require surgery.
Treatment. Or in treatment of any type.
Okay.
So if we agree that this cancer, if not treated, will cause problem, then we decide on the mode of treatment. Whether we're going to cure it or we're going to give treatment to keep the cancer at bay. Okay, so this is what we do. So the diagnosis is key. And then seeing a urologist is also key. Because I think that urologists are the only ones who have capacity to analyze the histology and at the same time analyze some other parameters and decide that this one deserves this type of treatment or this type of approach. So this is how we go about it.
Cancer is a horrible thing, man.
Well, cancer is a horrible thing. Prostate cancer is not doom and gloom. Okay, we have a subset of cases we don't do anything to them, not because they have spread. They are still confined to the prostate, but because of its low degree of aggressivity, we decide not to do anything but keep an eye on the patient, so that if at the point in time the cancer changes
to become a bit more aggressive, then it needs to come out.
Exactly so.
But I've had I think a couple of people that we've gone to see a urologist with, and the urologist after examining said, yeah, there's something there, but we don't think it's significant enough to require an intervention. And if you leave them alone, the person will die from something else and not the prostate.
Exactly. So
and truly, that has actually played out, that the prostate never worried the person again.
It's true.
So I think that is a nice thing that has. But how we can get our men to decide to be a little bit more concerned about their own health, to ensure that they would live long, has been one of our biggest headaches. So thinking about that, we've got Greater Accra Regional Hospital, we've got Kwelebu, we've got the big hospitals. What about the men in the rural areas?
Unfortunately, the care doesn't reach them. The men in the rural areas, one, may be ignorant, and those who are not ignorant do not have anybody to go to. Okay, even if they have somebody to go to, they will not receive the best of
care when they do indeed go there.
And even if they can get the best of care, they can't afford the system. The full rigor of the management regime. They can't afford. So there are a lot of barriers. Okay, barriers for those in the rural areas and barriers even for those in the in the cities. Okay.
What are the so we've been talking about cancers a lot, but something just occurred to me. Person has got prostatic hypertrophy. You do an assessment and you decide that the person needs surgery. What are the surgical options available in this country? Or the solutions available in this country?
In Ghana,
it's big enough to require intervention.
Yes, in Ghana, practically all that has to be done, or that all that is done in the world, I mean, is being done in Ghana as well.
Nice.
But traditionally, I mean, with very, very enlarged prostates, we've traditionally done a open
Prostatectomy, meaning we take out the prostate.
not the full prostate, but the part that is, causing the urine problem.
Okay.
The adenoma, as the wise will call it, okay, or science will call it. Then, in some situations, the prostate is not, too big. So another approach is given to it called transurethral resection of the prostate. It's also done in Ghana, especially what about the urologists. That's where the doctor introduces an instrument into the bladder, and then with that, the prostate is scraped gradually, thereby reducing the size of it. And then the patients can go home, within 2 or 3 days, and with that, I mean, the catheter is also taken out.
That's it.
Okay, so they spend fewer days, in the hospital, and I mean, the recovery is quick. Okay, but that one is reserved to only processes that are not big enough to warrant open surgery, or prostates. If you want to do the TURP, it must be between 45, maybe a little bit before 1 hour. Okay, if that thing can be done within this short time, then it has indication for TURP. Okay, but unfortunately, at times you won't have access to the technology and all that, but it's not something which is scarce in Ghana. It can be done. Then we have another one which is a laser prostatectomy. Yes, we have laser in Ghana, but it is not found in all the hospitals.
Okay.
You can see that can be used for bigger prostates. Okay, those that TURP cannot.
Is that also transurethral? Do you go to?
It's also transurethral.
Okay.
It's also transurethral, and it's also being done in Ghana. Okay.
What about interventional radiology? Do we have a method?
Yes, I mean that one. Some type of surgery is being done at some private institutions.
Yeah.
Okay, they are not done in the government institution.
Yeah.
They're done in private institutions, and they are astronomically expensive, and so it means it is reserved for only a very few patients. Okay, and I mean it also has its own good side and then a bad side. Some patients may not get improvement in terms of their symptoms.
Symptoms, yeah.
Others also call it as God given a technique. That is it.
Dr. Q,
Yes.
what do you want men to know about their prostate health? What do you wish all men would know?
That's a very dicey question, but men need to understand that the prostate is not paramount for life, but then you need to know its state, and you need to know that it's in a good condition. You may live without a prostate. You don't necessarily need the prostate to live, but you need it for your fertility status because of its function in enhancing or contributing to semen. So that is why you can have men having their prostate removed, but they are still living. But if you
And sexually active.
But if you want to be productive and procreate, you need to, have your prostate checked. You need to have it screened. And as a matter of fact, every man is born with a prostate. So the funny thing you hear sometimes on radio is that they make you look as if that the word prostate, they make you look as if the word itself
Having
having
a prostate is a problem.
Yeah, that is how they make it. They make it look sometimes, but everybody is born with a prostate. It's just that it's just unfortunate that as we grow, it also, the enlargement may set in, the cancer may set in. That is where it becomes necessary that we all get to know the state of our prostate. So, like Doc said, 50. But on our side, we even advocate 40 years because of what we are seeing.
Of course,
now.
that's the point.
So for me, it's the earlier.
Traditionally,
the better.
it has been 50, but if the population is changing, we have to change with the population.
Precisely. So 40 years and above, if you're a man watching or listening, just get to know the state of your prostate. Once the state of the prostate is known, if it's in a bad condition, there are interventions. Even if it's cancerous, depending on the stage of the cancer, your practitioner or your doctor or a caregiver would know what to
The
do
necessary intervention to give to you.
precisely. As
Not
early as
knowing is
possible.
the problem.
That is it.
But once you know, there are
There
solutions.
are solutions. So that is my word of advice to all men. Get to know the state of your prostate. It's important to know.
Man, things that we are all thinking of how to solve that child's problem, that wife's problem, that other people, my family people's problems.
Precisely. And then we forget about ourselves.
And then forget about ourselves.
That is why women have a longer life expectancy than men. He mentioned it. Men, we are stubborn. We will never go to the medical facility to even go for a total checkup. We will wait until we start seeing that
some symptoms.
something is happening. But the woman, as soon as she senses something, she would go and have a checkup. So men must now take their lives. You need to live to be able to take care of everybody else. So
Yeah.
when you are concerned about everybody and then you neglect yourself, you will end up not being of benefit to anybody at the end of it all. So I mean, the men must take it upon themselves to get their prostate screened and checked. Now, thank God, like doctor said, he personally is no longer doing
The DIA.
So why should we be afraid of a finger being inserted into a rectum? Now there are non-invasive procedures, all right? So the ultrasound is there. If you have the means, you can even go for an MRI.
Yeah.
You can do the PSA. These are some of the simple procedures that you can get to know the state of the prostate. So men should just walk into every facility and have their prostate screened or checked out. It's important, you know.
Dr. Bachi, what do you want every man to know about their prostate?
Well, that the prostate is a normal organ. That the prostate is a normal.
It's a normal organ.
Yes, we are born with it, and that as we grow, it can become bigger, and then that the enlargement could be part and parcel of the growing process. That the enlargement per se is not a big problem, but what is the big problem is the prostate cancer. Okay, that is what we're all afraid of, and that, I mean, as I was saying, I mean, at the age of, some may do it earlier, but we say that at the age of 50, that is where the cancer begins to peak. Okay, so from there, they can start doing PSA if they haven't started it. They should do PSA as regularly as they can, as they are patient enough. Because some part of the world, patients don't want to do PSA quickly because they are afraid that they'll have raise PSA and they may say, hey, this is prostate cancer. They say what you don't know doesn't kill you. So some will wait, but it shouldn't be so. Okay, at least doing PSA once a year is a good idea. That would be, a simple approach to diagnosing a deadly and complex disease.
Ladies and gentlemen, this coming Sunday is Father's Day, I believe. For the men in your life, if you really, really, really love them, one of the gifts you can give to them as a sign of love and care is to let them do a screening test for their prostate health. Yes, sometimes the results may make you be a bit frightened. But we are looking for the ones that, unknown to us, there's something growing big and fast that if only we intervene early, can be life transforming. I'd like to thank Dr. Boachi of the Greater Accra Regional Hospital for bringing us his urology expertise. He has devoted his life to relieving men of those kinds of burdens, and we are grateful.
Thank you too.
I'd like to thank Dr. Q of the Executive Prostate and Herbal Center. Hey, it's a whole center just for the prostate.
Yes.
Hey, chai. I'd like to thank you for your expertise and the insight that you have brought, especially in the preventive aspect and the kind of interventions that we can put in place so that we will not need as many people getting to that stage that will require a lot more interventions. As for us, the rest of us, we're now going to plan how we'll do a prostate health assessment as our Father's Day gift to ourselves.
Yeah.
They say Mother's Day. Even Mother's Day, I'm walking on the street, you meet a woman. Oh, how are you? Say, you didn't wish me Happy Mother's Day. Say, you are a mother to who? Me in my life. What in my... Anybody, even those without mothers cry, they're asking you. Those who are not mothers are asking, why didn't you wish me happy Mother's Day? It's like, oh, okay. So happy Father's Day to yourself. Please go and get yourself this. But to all men out there, you do a great job. Your impact is life transforming. You are creating businesses, you are creating giants, you make the world go round. And you deserve to give yourself a little bit of attention, a little bit of pampering. And since we are practical, it will not be something that is, what pampering usually is expected to be. But at the very least, take good care of your health. Because your family needs you, Ghana needs you, and this world needs you. Thank you very much. This has been a Zed Wellness Link, and we thank you for your attention and your time. Take care. God bless. Bye-bye.
Father, the glory belongs to you. The glory
You're tuned in to Zed 101.9.